Good afternoon, everybody. It's been a little over a month since we got a COVID update. A lot has happened in this month. A lot has happened if you're following the FDA and the CDC. And right here we are in the LOB, Legislative Office Building. We'll have some votes to make in the next week. So just wanted to give you an update on where we stand on COVID right now. And I'm here, of course, with Paul and Josh. And we have a new friend, Manisha Jitani. Manisha is our Commissioner of Public Health. Manisha, many of you have met before because she's been advising us over the last year and a half in her perch as infectious disease professor at the Yale School of Medicine, Yale School of Public Health. And so pleased that she's able to step up as our Commissioner of Public Health, which frees our other friend, Deirdre Gifford, who stays in her role at Department of Social Services, but also overseeing Health and Human Services. There's a whole alphabet soup of different entities here within state government that deal with healthcare. That's the Healthcare Exchange. That's the Department of Children and Families. That's Department of Veterans Affairs. That's Early Childhood. That's DEMAS, Mental Health and Addiction. That's Medicaid. That's Healthcare Strategies. So Deirdre has been doing yeoman's duty, and now she'll be able to focus on that major role. And thankfully, Manisha is here as Commissioner and here to answer any questions that you may have. Let's just go with the old format just to give you an idea of where we stand. I think what's interesting in this chart is that we're still doing a lot of testing. Our positivity rate is low compared to the rest of the country. Thank you for that, in great part due to your vaccination strategy and the fact that we have people vaccinated. It's at 2.28%. The 7-day average, just to give you a little perspective, is at 2.7%. So it's actually trending down a little bit, which may be positive. You may wonder where we were a month or so ago. We were at 3.5%. That was, the beginning of that Delta, and we looked at what was ramping up, especially down in Florida and Georgia and Louisiana. So we got up to 3.5, trending down a little bit. Where were we at the beginning of this year when we had that last, bigger surge? We were at 7.5%. So for me, the relative good news is that each of these waves, the severity goes down a little bit, and that's in large part because of the vaccinations and the management we've had over the last, year and a half. As we continue to keep our society open, our schools open, our service sector open, we're able to do this and keeping you safe despite each of these different hits. That's not true everywhere around the country, I might say. While we've been relatively better off, we continue to look at what's happening. We continue to look at the fact that COVID is ramping up in other parts of the country, maybe a little less in infections in Florida and Louisiana, although fatalities are still really severe there. It's coming up a little bit, North Carolina, West Virginia, Alaska. Alaska, way to the north, you figure they're able to be outside a lot longer. They have about 120 per 100,000. We're at 20 per 100,000, 6 times more severe than we are. So when I still err on the side of caution, I'm trying to make sure that we don't let any of these outliers become Connecticut. Outliers including West Virginia, Wisconsin, Michigan. West Virginia has the third highest fatality per capita in the country. So it is beginning of our flu season. Let's be careful. Next on the chart, you see 13 additional on hospitalizations, which in hospitalizations is we reached our peak in this latest Delta phase at about 391. Back at the last winter, when you were at the heart of the flu season, we were at 1,300. And back well over a year and a half ago when we first got hit, we had 2,000 people in the hospitals and ICUs. So again, from 2,000 to 1,300 8 months ago to 391 now. I hope you can see the relative progress we're making, thanks to you. Thanks to you for being careful. Thanks to you for keeping our schools open, wearing the mask, and getting vaccinated. Where we stand, very quickly, I don't want to dwell on this chart. We've done really well in average daily cases, about the lowest in the country. We've done really well on vaccination rate, about the lowest in the country when it comes to adults who are fully vaccinated. Two things to remember here. We still have 600 people a day testing positive. We still have a few hundred in the hospital. And on the vaccination, remember about a third of our population is either not vaccinated or ineligible, meaning those are the kids, under the age of 12. So I do not want us to put out the mission accomplished banner on the aircraft carrier. I think it's worth being cautious a little longer, and that's what I've tried to impress upon our friends in the legislature as well. Next chart is just a reminder that vaccines work. Okay, this is an eye exam. Thank you very much. I'll try and tell you with my tired eyes what I see. On the horizontal axis is the percentage of the population that's fully vaccinated. I think you can see that blue arrow, that points at Connecticut. So you can see that the furthest to the right is the best you are. Here with a different metric, we're right behind Vermont. We're coming to get you, Vermont. And the vertical axis is the deaths, COVID-related deaths per 100,000. And that's over the last 6 months, not going back to the beginning of COVID. So there, the COVID fatalities over the last 6 months, those dots high up on the vertical, I'm afraid that's Florida, Louisiana, Arkansas, Nevada. Again, we're relatively low on that chart, and that is thanks to each and every one of you and what you've been doing. I will tell you that a year and a half ago, while nobody was vaccinated, that horizontal was nowhere. We were very high when it came to fatalities. That's when we were all still feeling our way as a country, and you did not have any vaccinations. You can see the relative progress we've made, which is what I want to try and impress on you compared to where we were last flu season, where we were Delta, and where we are today. Another way of looking at that is the next chart, the town-level COVID alerts. 5 weeks ago when we got together, you maybe remember, woe was us, the whole chart was red. And red meant you had more than 15 cases per 100,000. That was the most severe in terms of CDC guidance, in terms of being particularly strict. I think today you can see that we've made extraordinary progress down there in the Southwest. Urban as well as suburban doing relatively well. Southeast Connecticut, I'm afraid, up there in the and the Northeast, that is certainly the reddest. I think that reflects a little less likely to be vaccinated, a little more likely to be infected. Sadly, New London is got the most infections. But on the positive side, Canaan and Norfolk, even Danbury. Remember how hit Danbury was 6-7 months ago? Today, Danbury is in a much better situation, 5 to 9 cases. So it is working. I was also interested, you won't be able to see this, and I can barely see it, but Mansfield is in not the most severe situation, much less than that. Mansfield, of course, is where UConn Stores is. So even in a place like that, all the kids required to be vaccinated at UConn to be able to live on campus. You see that they are much lower in terms of cases per 100,000. It's working. All right, so where are we now in the process? We are planning for boosters. I think you saw just yesterday, I think it was, the FDA came out with their booster protocols for folks over the age of 65, Pfizer only, and those with some pre-existing conditions, and those in an essential worker category, sort of that same metrics they gave us back early on in vaccinations. And very soon, I think we're going to hear on kids ages 5 through 12. So CDC approval, I expect it, and Manisha confirms this, probably within 24 hours. So we'll be able to start rolling out booster shots for those over the age of 65. When it comes to folks with pre-existing conditions, you remember that broad laundry list they gave us last time. When it came to essential workers, that included, half our population. It wasn't very effective. I would say two things. One, we got about 275,000 people. Pfizer only, remember, we don't have permission yet for J&J and Moderna. There you probably you're going to have to wait a little bit longer. Um, so you can go to any of 800 sites. In that sense, we're ready. And we'd urge you to sort of self-declare. I mean, obviously, you show that you're over 65 is easy. We'll get the guidance from CDC. If it shows that you have a pre-existing condition, you just declare that, and you'll get the booster shot. If it shows that you consider yourself an essential worker, frontline healthcare worker, interfacing, you'll get the booster shot as well. We're in a very different situation when we were first time around. First time around, people were going from zero vaccine, and people were desperate for the vaccine, and we didn't have nearly enough vaccines. So we had to be very strict on the age base, which I think was a good move for Connecticut. Now I think we've got age-based 65 and above for the booster shot, Pfizer only, plus those two other categories. I think you can self-report, in large part because we have plenty of vaccine and we can address any particular needs. That means if you feel more comfortable, make an appointment. Go to ct.gov/COVID vaccine. They'll tell you where your closest vaccination spot is. They'll tell you whether they have Pfizer or not. You can make an appointment if you feel comfortable there. I think almost all of them are also taking walk-ups. If everybody doesn't rush at the same time, I think we're going to be in pretty good shape. Nursing home, especially for the nurses at the nursing homes, but plus also the patients, I think we're going to be able to begin that almost immediately now. Make sure that all those nurses are vaccinated and get booster shots for the folks who are there at the nursing homes, our parents and grandparents. We're not going to let what happened early on in this pandemic. We're going to pay special attention to our loved ones at the nursing homes. And the EUA, the Emergency Use Authorization for the kids, 5 to 11, that's going to be a month or so away. I think that will be good news. That will mean we start getting young people in our schools vaccinated, and that may mean we can take a second look at some of the protocols we have as time goes on. Finally, the legislature will be coming together for a special session. I think it's Monday and Tuesday. Paul's been having active discussions with the leadership, and we need to keep the emergency authorization going a little bit longer. We've asked the legislature to weigh in. I want their input. I want them to vote on our emergency orders. We've narrowed it down from 300 or 400 down to 10, which are really key to keeping you safe, really key, strictly limited to, pretty much to public health. That includes, you see on this list, vaccination access. That in particular is to make sure that you can get your vaccination and now your booster shot for free. No in-network, out-of-network. We address that. That includes the vaccination mandates. We've obviously said, when it comes to nurses and frontline healthcare workers, you must get vaccinated, no exceptions, same as, the federal government has, told us to do as well. Paul has been leading discussions with Faye and Melissa and our friends and state employees. I think we're very close to be able to work out the protocols and get all of our state employees vaccinated, and if they're not vaccinated, tested. So we'll be able to start on that early next week, which is what our plan was. What else? Indoor mask requirements in high-risk facilities. Some of that is required by federal law. A lot of it we do as well. That includes healthcare facilities. That includes nurse homes. That includes clinics. That includes public transportation depots, airports, as well as local bus. Temporary staffing support for our nursing homes. We're looking at labor shortages. I got to make sure that we have the people there, so we have some certifications and things that allow it easier for people to be in our nursing homes. One little out is the Unite CT. Unite CT is the hundreds of millions of dollars we got from the federal government that allows us to mitigate problems between landlords and tenants. It is a public health issue. I do not want people on the street, and I do not want a lot of people in congregate settings. We have money to help make the tenant good, and more importantly, in this case, make the landlord good so they can stay together, people stay in their homes. So we've got a 30, 60-day appeal period. That's an EO I'd like to see continued as well. And I can't tell you what tomorrow will bring. I see how much has changed in the last 30 days, not to mention the last 90 days. We have to be able to move quickly. I think we have in place, following the bipartisan agreement that the leadership on both sides of the aisle agreed to a few months ago in the legislature, that says if they approve, we get our executive orders going, you, the legislature, vote on it. If any of the leadership, Republican or Democrat, want to take one of those items, out or take a look at it or make changes, you call the Speaker of the House, Matt Ritter, or the President of the Senate, Martin Looney. He will get the gang of six, the legislative leadership together. You can vote up or down, so we get the legislative input, which I think is really important. Things are fraying a little bit at the edges. I want us working together, and that includes Republicans and Democrats, both on board with what we're trying to do to keep you safe. I think that's enough for me. Paul and Josh and Manitha, please, let's take the questions.
News 8.
Good afternoon,
Governor. I believe this question is. Wow, we have two people on for News 8. Real quick for the governor, the amount of money that's being spent on testing, is testing still free? Because we've had clinics saying no, if there's a $100 copay or there's a $200 fee for the test. Where do we stand on paying for testing?
Want to take that, Josh?
COVID testing for. Turning this on. Yes, so COVID testing for people who are symptomatic or who have been exposed to someone who has COVID is free, and people should not be getting copays or getting charged for that. Where there could be issues is if people are going back to be repetitively screened, asymptomatic. Some insurance companies will not cover that, but for the most part, COVID testing is free.
So if you have insurance, your insurance will cover it 100%. If they fall into that category you just described.
If you're symptomatic or if you've been exposed to someone who has COVID, absolutely.
Okay, and if you don't have insurance,
if you're symptomatic or if you've been exposed, that will be free as well. There's state funds available to cover people who don't have insurance who need to get tested.
thank you.
Governor, this is Jody Latina. I have a quick question about the school bus driver shortage. Are you in a position to be asking the National Guard to step in on Monday? We're hearing hundreds of drivers are not going to be continuing their jobs after tomorrow with relation to the mandate for the vaccine.
I can tell you we're in active discussions with the bus drivers. I can tell you that we've done everything to accelerate getting additional bus drivers in place. I can tell you we have some healthcare drivers. They'll be able to step in and help for some of those kids with special needs. They can't drive the school buses, but they can do that as well. I haven't had a request yet, Jody, for the guard, but I'm making sure our kids are able to get to school. And I just tell the bus drivers, you're in a tight congregate setting, a bus, surrounded by kids who aren't vaccinated. We're trying to keep you safe, and we're trying to keep them safe. Anything to add on that, you guys?
Yeah, no, I think you hit the key points. I mean, we've got all the state agencies responsible for approving new bus drivers, expediting every new request that comes through. The governor mentioned we've got our partner who does Medicaid transportation services. We've connected them with a number of school districts who expressed potential concern about driver shortages. They already have the background checks, the necessary precautions to be able to drive students. So they're, in often cases, taking routes for special ed students or other out-of-district transport, freeing up those drivers to drive the big school buses. So we're providing support across a number of different districts, and we are on call to do everything we can to help. But we do know that some districts are very concerned about disruptions early next week, but we're definitely hoping to avoid that.
NBC Connecticut.
Hello, Dr. Giuttani. It appears over the past week or so that the daily infection rate numbers are coming down a bit. Do you think we are nearing the end of the Delta wave? And what does that mean as we head into the fall and then into the winter? Do you think we'll actually be in a better place as the weather gets colder?
So I do think that we seem to be reaching a place where we have plateaued and potentially going further down, which is really good news for Connecticut. I think we need to continue our vaccination efforts so that we can try to prevent any sort of surge that might come this winter. I think it's unclear at this point whether something else may happen, but I think things are looking very promising at this point. And as we get children eligible for vaccinations as well, there is the possibility that we will be able to continue looking better and better. But I think that without vaccinating people and as many people in our state as we can, we run the risk of COVID-19 surging its ugly head again. So I am cautiously optimistic. It is the winter months when respiratory viruses circulate in general. So we have to be prepared for that. We have to be prepared for the worst, but I am cautiously optimistic.
And as far as the booster shots go, what's the process from getting that federal approval to getting the booster shots in the arms of people here in Connecticut? What do you expect the turnaround time to be?
So we know at this point there is a meeting of the ACIP ongoing right now, and we know that people 65 years and older have been approved. So people can start to get vaccinated as early as tomorrow who are 65 and older. I think the recommendations for those under 65 are being discussed right now, and people can make those appointments and start going out to do that. The one thing I would say is that people have to remember that they already have immunity. This isn't going from zero immunity and the mad rush that we had back in the spring. But for our older adults, I would recommend, now that we have these recommendations, that they start to go out there and get their boosters. Of course, those who have been vaccinated with Pfizer only at this point. For those that received Moderna or J&J, we have to wait a little longer.
And lastly, there have been some mixed messages over the last few weeks from different government entities and the companies themselves about the need for booster shots. What's your take on the FDA's decision yesterday? Do you feel like you're getting a clear direction from the feds?
We know from the science and the data that the groups from the beginning in this pandemic that have been most affected by COVID-19 are our older adults. And so this is a very clear message that for older people, your immunity wanes over time and are the greatest group to potentially benefit from a booster. So I think this is exceptionally clear. What we're seeing from the data is that for people under the age of 65, that immunity lasts a little bit longer in different circumstances. Some people may be immunocompromised, some people may be more at risk based on their profession. So I think there's more nuance left there, and time will tell based on our recommending agencies exactly what is recommended for those other age groups. Over time, I think we've known from the beginning that it is likely that immunity will wane. So when boosters will be required for those under the age of 65 will be determined in the days and months ahead.
Thank you.
Fox 61.
Good afternoon. This is Gabby Molina with Fox 61. Governor, I know as part of the extension of your emergency powers, it would extend it to February, and part of that is that school mask mandate. Does that mean it automatically goes until February, or if children are able to get vaccinated between now and February, would you consider getting rid of that mask mandate?
All that means is we'd be allowed to continue that, through that date, mid-February. But as Manisha said, we look at the facts on the ground. If we have an overwhelming number of our kids who are vaccinated by the end of December, you can take a look at that.
And do you have any response to the people who might be a little bit frustrated that the special session is not going to include some of the other topics that people were hoping for, whether it be TCI or the addressing crime in the state?
They can discuss anything they'd like to. Right now, it seemed to me that on crime, we've done what we can do here. I haven't heard any specific proposals that anybody wanted to discuss that require a full legislative review, but that's something they can consider. What I have done is we've, municipalities called and they asked for money to help with overtime for police. We said, here's money for overtime for police. They've asked for additional support from our state police. I said, here's additional support for our state police. They said we need, help for wraparound services, social services, mentors, support for a lot of those first and second time offenders. We've given tens of millions of dollars additional for that. And speaking of which, community policing is primarily a municipal function. So, we've given about $500 million, federal money primarily, to our towns and municipalities. And I would think that many of them would think about adding to their police forces and get more community policing on the ground. That's a long answer to your question, but I think at this point I haven't heard of any specific suggestions that require immediate action.
Thank you.
Channel 3 Eyewitness News.
Is the state doing anything to make sure only people who are eligible get the booster, and how will that be monitored?
So we had a little bit of a hard time hearing you, but I think your question is, are we going to be monitoring who's getting boosters? And the short answer is we, through one of the executive orders, healthcare providers have the ability, if someone needs help determining if they're 6 months or more outside of having received their second dose of Pfizer, if they're therefore in the recommendation, our healthcare providers can now help them look that up. But we are not anticipating a onerous process for people to get their booster. As Dr. Giussani mentioned, we'll get the information out. We'll make sure that the CDC and FDA recommendations are cascaded. But we're anticipating, based on the fact that we have, essentially, we're not constrained on supply nor on vaccination administration capacity, that we're not going to have to have a lot of rules in place to govern that.
And does the state have a plan in place for how the shot will be distributed to kids ages 5 to 11 when it's available to them?
Yeah, so our Department of Public Health has been working extensively with pediatrician practices to help and get them enrolled in our immunization program for COVID-19 in anticipation of that. So, parents and their children should anticipate a lot of opportunities to be vaccinated in the traditional healthcare settings that they're used to, in particular their pediatrician offices and other settings that are comfortable for children and families, in addition to some of the more traditional vaccination sites that exist.
And Governor, a coalition of school unions met today to ask the General Assembly for help to fund air quality in schools. They say that elementary and secondary school relief funding and local taxes isn't enough. Any response for them?
Yes, I mean, we've used a lot of our ARPA resources, the federal resources. About $500 million have gone to our local superintendents. They have broad discretion over how that money is spent. A lot of that's going to be in terms of social services. If you're in a particular school where you think ventilation may be a priority, I would think they'd use some of that money, at least for filters on the ventilation.
News 12 Connecticut.
Good afternoon, this is Josh Bedrosian with News 12. Do you guys know how many people would be eligible for the Pfizer booster come tomorrow if you do start administering it?
Yes, so we believe there's approximately 430,000 Connecticut residents who received their second dose of the Pfizer vaccine 6 months ago or longer. So that's likely the total population. Now, that breaks down 270,000 of those 430 are above the age of 65. So those are very clearly, as we understand from the meeting that's going on right now, likely to be recommended. The other 160,000 are under the age of 65, so we're going to have to wait and see the additional details that come out of the ACIP meeting that's ongoing now, how many of them are recommended to get vaccinated immediately, get their booster immediately.
Now, when it comes to underlying conditions, which types of people fall under this category to get the booster shot?
So the way I understand the language is that for those that would be at high risk of complications of COVID-19. And so that is something that a patient can discuss with their physician. And based on the recommendations that come out, we will certainly recommend people to go and get a booster shot accordingly.
The Associated Press.
Thanks, Max. Good afternoon. Governor, where do things stand in terms of how the remaining, I think it's about $280 million in American Rescue Plan money is going to be spent? I know that there was a call to try to provide so-called hero pay to a bunch of people. And also, as someone mentioned earlier, the schools and the municipalities say that they need much more money to provide new HVAC systems and things like that, air conditioning, and they're looking to this money as well. So it seems like a lot of people are hoping for some of this.
I'll start with that, Sue, and then hand it over to Paul. But first of all, look at the 500 million schools you've got right now. Give us your best analysis of how that money is going to be spent. I want it to be spent productively. I want it to be spent effectively, and I want to hold people accountable for that, how that money's go. That'll be compounded by another 500 next year. That said, we do have some reserve in our ARPA money, which is the federal money. The money goes for at least 2.5 years, depending on the category. And we could find that dramatic needs change over a period of time, and I think having some of that in reserve makes sense. But Paul, do you want to add to that?
Thanks, Governor. I think the governor said it very correctly that those funding that was allocated by Congress in the White House has over close to a 3-year spending level. So the one thing the governor has asked Secretary McCall, myself, and Josh Jabal to be very cognizant about when it comes to those funding is those fundings have to be utilized for best use and make sure that it's long lasting. There are other funding allocations, as the governor has mentioned, especially on the education side, that has been provided to our local municipalities and our school districts. But at this time, right now, we are still monitoring and seeing how the COVID-19 pandemic is taking its head here in the state of Connecticut. And we will continuously evaluate how best to utilize those funding in the future. As you also are aware, those funding has to go through a process through the legislature. So we'll look forward to having continuously conversations with the legislature about the utilization of this funding. But at this time, we're keeping those dollars in reserve and we'll be evaluating them on a day-to-day and a month-to-month basis.
Thank you for that. But however, is some of the money set aside for the bonuses to essential workers? I thought that was a done deal.
Yeah, that was in the allocation that was passed by the legislature. It was approximately $20 million. Right now, the Office of Policy and Management is going through a process, and we'll have conversations continuously with the state employees unions and others in terms of the appropriate allocation of those dollars. But yes, there is currently an allocation that is set aside that is $20 million that's inclusive of state employees and the men and women of our National Guard.
Thank you. And what are we seeing in terms of the daily or weekly demand for vaccinations these days? It seems like a lot of people who don't want the shot have really dug in and they can't be persuaded to get it.
You have the numbers, Josh?
Yeah, well, fortunately, we're still seeing 15,000 people a week come forward to get their first dose of the vaccine. So, we're getting down to a smaller percentage of our population, thankfully, that hasn't gotten vaccinated yet. We're still seeing people come in, and I think some of that has been a function over the last month or two of the Delta wave and concerns around that. There's obviously been a number of employers, including the state and the vaccination mandates that are driving some additional vaccinations. So we are considering to see a pretty steady stream, which is very encouraging.
And one last one, what are we seeing in terms of new variants? I know Delta Plus is a big concern.
Anisha?
So as long as this virus is circulating, you may hear about a new variant that pops up here or there. Overall, we are not seeing a threat from a variant at this point that we think is imminent or of such a large scale that it would impact the citizens of Connecticut. That does not mean to say that if communities around our country or even around the world have large surges of a vaccine resistant virus or just a variant that's new emerge, that couldn't find its way to the United States just the way the Delta variant did, which is why we just keep on pushing vaccines. But I think at this point in time, I am not concerned about a new variant that is particularly worrisome at this moment in time. Things can change as things go ahead, but right now I think we're in a good place.
Okay, great. Thank you so much.
Connecticut Public Media.
Hi, Governor. Ali Oshinsky from Connecticut Public Radio. What is the mechanism for the state to know whether its employees are vaccinated and in compliance with the mandate coming this Monday?
Well, I'll start and then pass it right to Josh, but I can tell you that right now people are self-reporting. They're giving us their status in terms of vaccination. I think that due date is probably next week, the 27th. And Josh?
That's exactly right. So by Sunday night, employees will have to submit their either vaccine documentation or their weekly test result through the online system that we've established to be compliant by the 27th Monday, which is the effective date. So next week we'll have our first complete look at vaccination rates across our agencies, and we certainly plan to share that data once it's available at an aggregated level.
Will you be sharing that by specific agency?
Yes.
And is there a penalty for employees who don't comply by Sunday night?
So for employees who don't comply, as the governor mentioned, we're finalizing negotiations with our partners in labor around what the discipline will be. So I wouldn't want to comment on that at this time until those negotiations are complete, but there will be significant discipline for non-compliance. In addition, the employees, when they submit their vaccination or their test results, they attest to the validity of those results as well, and it's a misdemeanor for providing false documentation that has significant penalties associated with it as well.
Great. And lastly, when will the state be reporting those vaccination numbers? On Monday?
It won't be on Monday. We're going to be getting a lot of information in over the weekend, and the teams will need to input that, but probably later next week.
Thank you.
Welcome.
WTIC 1080 News.
Dr. Giuttani, as it's been pointed out that much of the country is still having trouble getting people vaccinated. Does that put the gains Connecticut has made in jeopardy at all?
I would not say so at all. I think the fact that we can see our numbers being so much better than many other states around the country. You heard the numbers from the governor at the beginning, where we had a surge in hospitalizations and deaths in the first wave. The second wave was smaller, and this Delta wave has not hit us like it has hit states that have very low vaccination rates. So I think our gains are still to be felt, and the fact that people are able to do many things in our state, maybe they have to wear a mask when they do it sometimes, but at the end of the day, the fact that life is opening up shows the proof of how vaccines are working, how our hospitals are not overloaded like they were the first time or the second time. That doesn't mean they're still not full of people that are sick, sometimes with non-COVID related illnesses as well. But our gains are true and to be felt. Having said that, I raise the issue of what's happening in other areas of our country because circulating virus always is looking for susceptible hosts. And we still have about a third of our population in Connecticut who are either not eligible or who have not chosen to get vaccinated yet. So we need to really try the best we can, and that's why we have all these different measures in place right now, with mandates being one of them, to try to encourage people to get vaccinated, because that is the way that we are really going to be able to get life back to normal.
Thank you. And Governor, emergency powers through February 15th, which would bring it up to almost 2 years. Any doubt that that goes through?
I hope not. I think we've managed pretty successfully working together with the legislature ever since they put in place the EO protocols a few months ago. I think we're going to keep them involved. They're going to have a chance to weigh in and veto or opine on anything we do. And I hope that a vast majority on both sides of the aisle say it's working.
The Hartford Current.
Hi, Governor. It's Eliza from the Current. I just wanted to clarify, how exactly will the state determine which workers qualify for a booster shot? Can anyone who claims to be essential receive the shot?
From my point of view, you can self-report. I mean, don't abuse the system. But the good news compared to last time is we got a lot of vaccine. So it's not going to be really strict enforcement. I think if you're a state employee, you're interfacing with people on a public basis every day. You've got patients, you've got folks with special need. We take that seriously, but self-report, that's the best way to do it.
And Josh, I just had a question for you. So the state reports every day what percentage of hospitalized patients are vaccinated, but some of the hospitals say that those totals are a little misleading because many of the vaccinated people who are hospitalized were admitted for non-COVID reasons. Is there any available data on the vaccine status of those who are hospitalized specifically with serious COVID symptoms?
Yeah, no, it's a great question. There is not. That data does come from the hospitals. We can work with them to see if we can peel that back further, but you're correct. That data reports everyone who's in the hospital with COVID. Even many of the people who are fully vaccinated in the hospital with COVID are not there because of COVID. They test all admitted patients, of course, and so they sometimes pick up asymptomatic cases. And my anecdotal understanding from a lot of healthcare executives is that it's more like 90% of the people who are actually hospitalized for COVID are fully unvaccinated, even though that's an incredibly small percentage of the overall population. So it just further underscores how effective the vaccines are at keeping people out of the hospital. And Dr. Jethani, you may have some firsthand experience from Yale in particular.
Yes, I can just say that I have experience of that exact point, which is that sometimes patients are coming in for other conditions and just happen to test positive. And it is very difficult as a healthcare system, other than going chart by chart, to really be able to figure out, what the reason is that the patient is admitted for. So a lot of times what's being reported out is what is test positive. And so I think what we know from these data is that at the end of the day, the unvaccinated are the largest proportion of people that are getting admitted to the hospital with COVID disease. And the other point I just want to make is that if we look at the number of people that are vaccinated who are actually getting hospitalized, it is extremely, extremely low. It is a very low percentage of the number of patients that actually have COVID.
Thank you both.
CT News Junkie.
Thanks, Max. Governor, you sound sort of cautiously optimistic about the COVID situation as we head into this special session when you're asking for the emergency declarations to be extended. In your mind, is there any sort of metric or threshold for when we might not need these anymore? I know I've heard lawmakers suggest that it might be the point where all ages are eligible for a vaccine. Is there any, in your mind, threshold for that?
I can't give a number, Hugh, because COVID has just thrown so many curveballs. Where did Delta come from? I thought we had this thing more or less behind us a few months ago. Now it was not the ninth inning, but we're in extra innings. I do think, as Manisha said, that given the fact that we're overwhelmingly vaccinated, I think we have pretty good defenses, and I think that would mean by early next year, we're in a very different position. And that said, let's wait and see.
Okay. Earlier you said things were, in regards to this, I think you said things were fraying a little at the edges, and I think I know what you mean, but can you explain kind of what you meant by that comment?
Did you repeat that? Did you hear that, Max?
I said earlier when you were doing your intro, and you were talking about extending the emergency orders, you had said that things were fraying a little at the edges, and I just wondered if you could elaborate what you meant by that.
I just remember back a year ago when the pandemic was severe, and a year and a half ago, and how united this state was, and working through people making extraordinary sacrifices to keep each other safe. And obviously there's some really raw emotions. You've seen it. You've seen a fair amount of anger and distress about what's going on. There was hearings here yesterday, and I watched some of that as I was driving around. And I've got to do a better job of trying to convince people these are not restrictions we get any joy in putting in place. These are things we got to do to keep you safe. And I just hope we can hold it together a little bit longer. I see what's going on in some other states. I see the number of people refuse to get vaccinated, refuse to wear masks, and they pay a price for it. Connecticut has not been that way, and that's why we're in much better position than our peers.
Okay. Thanks, everyone. Thanks, Governor.
Hearst, Connecticut Media.
Oh, thanks, Max. Governor, it looks like you're in the LOB. You're not in that meeting room where they had the conservative hearing yesterday, are you?
I don't think we are.
I don't think we're in that hearing room, but the governor is, and the rest of our team is adhering to the rules set forth by the legislative leaders in the Office of Legislative Management. So as you see, when we're not talking, we're putting our masks on. We're adhering to the rules like everybody else does in the state of Connecticut to ensure the safety of everyone around us, because that's being a good partner and actually being a good citizen.
Thanks. Dr. Juthani, what kind of positivity number would make it easier for you to sleep at night? If we're below 3 now, what number would you feel more comfortable seeing on a daily basis?
Obviously, the lower the number, the better we are. But I think we are headed in the right direction. And I think people have been doing the right things. I think the overall map in the state of Connecticut is looking better than when the Delta wave first hit. So it does look like this is on the way down. I am concerned that there may be other respiratory viruses that will start to come back like they always do in the winter. But some of the masking we're doing will help with that again, which is promising. People can get their flu shots as they're thinking about COVID booster shots. This will help us get through the winter going forward. And at this moment in time, I think Connecticut is in a pretty good place. And I am hopeful that more people will continue to get vaccinated. So in terms of a number, I hope that if we continue doing those things, the numbers will go even lower, and so that we can be even more happy than where we are at this moment.
Hey, Manisha, could you expand on that? You told me yesterday why flu shots are even more important this year than yesteryear. I think you implied that a lot of kids who are in quarantine are not as involved. Do not have the defenses for traditional flu that maybe they've had in years past.
So one of the viruses that we've been seeing a lot of in children is called respiratory syncytial virus, or RSV. And there are children that have been in the ICU and have been hospitalized. And this is in part because some of these children may not have been exposed in the last season. They were doing school from home, they were masking, doing other things. And so now, as some of those restrictions relaxed starting in the summer, we saw more transmission of RSV, and in part because there were more kids that were probably susceptible. So in terms of flu, we've had no flu cases this year yet. And last year, we had such an exceedingly low number of cases of flu that it is possible that we will see a resurgence of flu this season as well, which is why, as we're headed into flu season, I really want to encourage people to get their flu shots, because we haven't seen a lot of flu in the last year, and every year we have deaths and complications from flu. People forget about this because it goes into the background and it's just kind of part of the natural cycle of what we go through as a society. But at the end of the day, this is a preventable disease as well, and at least a disease that we can mitigate how severe of an illness you get, just like we've been seeing with COVID. Even if you have the vaccine and there's a small chance you get infected, most of those people have not been hospitalized. And so I think we are in an opportune moment where people can double down and do all the things that we know we can do to prevent respiratory viruses from circulating, particularly with flu going into this winter season.
Thanks. Hey, and Josh, it seems like you probably have the numbers in front of you. How many people have been vaccinated with J&J and Moderna at this point?
I don't have that in front of me. I'll have to get back to you if you want the split out of the total. I can get that to you, Ken.
Okay, you deeply disappointed me. It took a year and a half. Hey, Paul. So you and Melissa McCaw had a memo to the nonprofit providers today talking about how extra funding for COLAs are gonna come by mid-October for these nonprofits, but the strike notice is talking about October 6th. How is that going to mesh? You worried about strikes occurring?
No, right. They know that the funds will be there. Those funds are also retroactive back to the beginning of the fiscal year. Just for everyone's understanding, those funds were connected to ARPA dollars. The last federal guidelines for ARPA wasn't really provided until the first week of August. It provided the Office of Legislative Management and all of those Health and Human Services agencies to do a thorough review just to make sure that it's within the guidelines. The letter that myself and Secretary McCall provided is to provide a sense of understanding and comfort to the nonprofit community so they can be able to get back to the table and negotiate a fair contract with their representative unions. We are adhering to our word, adhering to our promise, and that letter is to further provide that. So when they get into the room, there's no misunderstanding about where the state lies in their commitments. Our commitments is our word, and it's our bond, and that money will be out when we said it will be.
Thanks. And finally, Governor, do you have an opinion on how to solve the Department of Labor mess in which people who got overpayments are being chased?
Yeah, Ken. Look, go back a year and a half ago when the economy was closing down and the number of people all in the course of 30 days went up by a factor of 10 in terms of folks looking for unemployment. Remember how distressed people were in terms of where's my unemployment check? How come it hasn't arrived yet? At the same time, the feds were changing the rules on a daily basis. That said, Dante Bartolomeo, our commissioner there, has put in place really good electronic processes to root out most of the fraud, but there has some fraud that's slipped in. And I think you go after fraud. You go after those that stole ID. You go after those who are defrauding, the small businesses. They're the guys, I was one of them, that have to pay into this fund all the time. If there are inadvertent errors, if there are people that, filed for unemployment and then they also got their PPP money, I think there's ways that we can mediate that without, causing a lot of distress. So I think Dante's pursuing this pretty effectively.
Thank you.
The Day of New London. The Connecticut Mirror.
Thanks, Max. I wanted to go back to the school bus driver thing for a second. Do we have any idea, I guess, Josh, of a percentage of school bus drivers that are vaccinated? Is there going to be a large number of people who aren't vaccinated and can't drive the buses on Monday? Do we have any sense?
Well, remember, Dave, the school bus drivers also have the option, if they don't want to get vaccinated, to get tested weekly. So there is a significant flexibility there afforded to school bus drivers. But as the governor mentioned, again, these are individuals who are in obviously school buses with a lot of children who are often unvaccinated, and one of the two of those things is very important. We have heard and have been trying to collect data from districts around how many drivers are threatening to leave because they don't want to not only get vaccinated, but also believe it's too big a burden to ask to get tested weekly if they don't want to get vaccinated. That number is somewhat anecdotal at this point, but it seems relatively low, and we're hopeful that at the end of the day, as the governor said, drivers will understand the importance of these actions to keep themselves and their own families, as well as the children that they serve, safe every day, and that we won't see a lot of people resign on Monday.
I also wanted to follow up on COVID testing. The mandate goes into effect Monday. A lot of private companies are doing it as well. For the people who aren't vaccinated who have to get tested weekly, that is obviously surveillance testing, and the state's not covering that, correct? For example, teachers who aren't vaccinated, they're going to have to find a way to get COVID testing every week, and the state's not going to pay for that.
Right. So we are, with regards to state employees, that's one of the items that we're negotiating with unions about whether we will cover any of that testing, and if so, for how long. So that is an open item, but generally speaking, we do not anticipate repetitive COVID screening being covered, and that may become an out-of-pocket cost to employees whose employers mandate that. There's a very simple solution to this, which is get vaccinated. The vast majority of the adults in this state have, almost 80% of the adults in this state have gotten vaccinated. It's by far the most effective way to keep yourself and your family safe, and it gets rid of any concerns about inconvenience or money related to getting tested.
And then, I'm sorry, one last question, if I may. Do you have a sense of how many people have gotten the booster shot already? The people who are immune, I never can say this word correctly, compromised, have been eligible to get shots. I think it was like 15,000 a couple of weeks ago. Do you have any update on that?
Yep, we're up to 24,000 Connecticut residents who have gotten a third dose as a function of immunocompromised status, as indicated by our federal partners about a month ago.
And right now, they're included in the percentages, of the vaccine percentages that you put out every day. Are you at some point going to try to separate the third shot people? Because obviously that does impact the numbers.
They're only included once if they're fully vaccinated with the complete original series. So if you get a third dose, it doesn't increase the totals. We're tracking that separately.
Okay. Thank you.
Welcome.
The Waterbury Republican American.
Thanks very much. Just want to follow up real quick with Josh. The State Employees Bargaining Agent Coalition says that in an email to its members that employees who fail to comply with the testing mandate will not be disciplined, but will not be allowed to work or be paid. The parties have agreed that these employees remain in good standing with the state pending either the ending of the vaccine/testing mandate or their compliance. We have not reached agreement yet on further details. So you said earlier that they would be facing discipline.
Well, I think not getting paid, most people would consider pretty significant discipline. So going out on unpaid leave falls into what I was alluding to. And then what happens subsequently after a period of unpaid leave is what is continuing to be negotiated.
Okay. And Dr. Giussani, what do you think is a realistic expectation for, sort of a final COVID vaccination rate? We just heard a couple minutes ago that 80% of the adult population is vaccinated, but when you look at the, 12 and up population, which, older people can get COVID from people between 12 and 17, there's only 63% fully vaccinated and about 69% at least one dose. So what's a realistic expectation regarding, I guess, I don't know if herd immunity is even the right word.
I think the concept of herd immunity is something we heard a lot about in the beginning as the point at which the virus would not have enough opportunity to go from one host to the next. And I think what the Delta variant showed us is that our need to have even more of the population vaccinated was even more for this particular variant. So I think a firm number on that is very hard to come up with because, you know, a new variant could throw us a curveball and be very more infectious, just the way the Delta variant was. What is most important, though, is that, again, for children, as they become eligible for vaccines with this data on a dose that is 1/3 the amount of adult dose for Pfizer vaccine for those children, when that gets approved, I think one of the things that's important is that those children will be protected in the classroom, and if they're exposed to somebody else, they would not have the same requirements as somebody who's unvaccinated regarding quarantine and testing and all of that. And so we're seeing how life opens up with vaccination, and education can be consistent with vaccination. So I think a hard number here is going to be difficult to offer you, but as many as possible is going to be the key, and especially for children, because if somebody who is unvaccinated gets exposed to a case of somebody who is positive, their circumstances and their disruption in their life in terms of being able to go to school and activities and seeing friends is going to be very different than the vaccinated kid. So that is going to be the most important thing going forward as children become eligible for vaccines.
And can you give people an idea of, you know, what changes in the case, hospitalization, and death rates over time would lead you to judge that the public health emergency is over? Is there any kind of epidemiological modeling suggesting how much longer COVID-19 can be expected to last in Connecticut as a public health threat?
So I think, unfortunately, you know, in the beginning, in the first wave, we really looked at a lot of different models in terms of what was going to happen. And, you know, the viruses, in some ways, I often say, like, smarter than us, or the bugs are more adept at being able to try to survive, to keep on adapting, to be able to capitalize on the vulnerabilities they see in the human population. So coming up with a model when then you get a different virus or something else is unfortunately not that helpful. I think we're going to just have to take this one step at a time, but I am cautiously optimistic because we are much better than where we were when we started all this.
Okay, and a quick follow-up for Josh on the, if a state employee or somebody else isn't getting paid as a result of non-compliance with a workplace vaccine or testing mandate, will they be eligible to collect unemployment or not?
No, they won't. A key criteria for being eligible for unemployment is that your employer doesn't have work for you, and in this case, that obviously would not be true.
Okay, and for the governor, I know you've spoken about this in the past, but regarding the vaccinations for 5 to 11-year-olds, if it's only emergency use authorization, would you consider any kind of a mandate for school children of that age?
I doubt it, Paul.
Okay. I think, just one other real quick. 24 hours, at the beginning, there was statements about, you know, once we get the okay from the feds regarding the 65 and older group, that vaccinations could be administered in 24 hours, within 24 hours. Could you clarify that a little bit? I'm a little, I know it's been about an hour, so I'm a little fuzzy on that.
Yeah, I think as was mentioned earlier, so with the CDC ACIP committee approving, as we are kind of following it live here in real time, looks like they've formally approved people 65 and older who've received their second dose of Pfizer at least 6 months ago. Those folks can go out and start getting their boosters if they'd like tomorrow.
Okay, but the state will be able, I mean, you're ready to stand up a
Yep. Our
program
providers are ready. We've
go out to vaccine partners, go out to nursing homes.
Yep, we've been preparing for this. We've been expecting this, and our providers have as well. And
Okay.
you know, they're ready to go.
Yep, just
Right,
go to
thanks very much.
ct.gov, COVID vaccine, Paul. We'll get you signed up. I think we're about
I got a
there,
few
aren't
more
we,
years
John?
left, though. Thanks very much, Governor. That's enough for me.
Thanks,
One thing I would just say on that point is, as was historically the case last spring, as we kind of went from whenever a new phase opens up, there's often the risk that that very next day or two, there could be, at a walk-in site, there may be a bit of a crowd. So just be patient. We've got enough throughput in the system right now where everyone who's eligible, we're quite confident will have plenty of opportunity to get a booster dose within the next week, by next weekend at the absolute latest. So, I don't think a lot of patience is going to be required, but we'll see what happens tomorrow.
Okay, thanks very much.
All right, I got the signal here from Max. That's ct.gov/COVID vaccine. That's where you can start signing up, as we speak. Manisha, welcome to the team. Really great to have you here. And I just wanted to leave you with one last slide. I think, the most important metric, as we've gone through these different waves of variants as they've hit us in other states, has been hospitalizations. And we've worked very closely with our amazing hospital partners going back now almost 2 years to get ahead of this. And that's not true everywhere. And this has given us an opportunity to reach out and help those in need. Here's just one story about a Florida man with COVID. He flew up to a Connecticut hospital, and it's a life-saving decision. And I got to tell you, thanks to our hospitals, thanks to the fact that we have the capacity there to take care of each other and to take care of our neighboring states as well. Take care, everybody. All right, nice to see you again. Good to see you.